Well, it's National Diabetic Eye Disease Month, and having diabetes can lead to a host of health problems. But according to experts, vision loss is the most common but very preventable. And joining us this afternoon is Dr. Adam Ramsey. He's from Socialite Vision in Palm Beach Gardens. Dr. Ramsey, it's great to see you again.
Thanks for having me on.
Please talk to us about diabetes or diabetic eye disease.
Well, diabetic eye disease is very treatable and very preventable from having the risk of blindness. And 95% of the risk of blindness is just due to early detection. If I can get more patients to understand the benefit of an annual dilated fundus exam, just coming in regularly, even when you feel controlled, even when you feel like your sugar is doing okay, just coming in once a year to allow the doctor and the eye doctor to check and make sure that you're not having any negative effects due to diabetes in the eye. If we can get patients to understand that, 95% of the risk of blindness goes away, and it's pretty simple and easy.
It's a high percentage there. Well, are there any warning signs of diabetic eye disease?
From a patient's perspective, you can notice a fluctuation in your vision. So when your blood sugar is going up and down, your vision can get blurry. So say you look at the TV and normally it's clear, and then one day it's really blurry. A lot of times with patients that are diabetic, you can get a blur in your vision due to your blood sugar going up or dropping really down, like if you took too much insulin. You can also notice differences in color vision. So your perception of colors, blues, yellows, can actually change. That takes a little bit longer to happen, but patients may be able to see that themselves.
You talked about the prevention, but what should diabetics do when they are diagnosed with this? What's, I guess, a treatment?
Well, controlling your blood sugar is at the core and the crux of it. So most patients are going to know their hemoglobin A1C, which would be an average of their blood sugar over 3 months. It'll be a number between 5 and 20%. You want to see that number under 7, 6.5 would be great. From a perspective from the eye doctor, coming in annually to be checked and seen, and make sure that the physician that you're seeing is giving a report back to your primary care doctor, because you want your primary care doctor and your eye doctor to be working in cohort together, to be understanding, hey, this is where her blood sugar is, this is where his blood sugar is, and this is the effect you can see. I got a little diagram here, I don't know if you can see it, but the little blood vessels here, there shouldn't be red dots outside of the vessels. So the vessels and the arteries and the veins should be there, but the red dots should not. And that's when the blood leaks. Diabetes affects the small capillaries, the small blood vessels. And when your blood sugar is out of control, that dilated exam, we're looking to see, is it leaking? And when it starts leaking, what your physician is trying to find out is, if it's leaking in the eye, it's probably leaking somewhere else in the body. The eye is the only place where you can actually see the blood vessels. So your primary care doctor wants to know, is it leaking in the eye? If so, I need to maybe get your blood sugar lower than what I thought was controlled for that patient.
Great information from Dr. Adam Ramsey. He's from Socialite Vision in Palm Beach Gardens. Doctor, thank you so much for joining us.
Thank you.